And I've hit stream, so if there's anything wrong with the stream, I will let you know. But other than that, have a great meeting, okay?
Yes.
Thank you, Brandy.
Thanks, Brandy. Well, thank you, everybody, for joining us. We are fortunate today to have Sandra Eason Bruno from North Simcoe Muskoka Specialized Geriatric Services joining us. And we're going to let her take some time to explain to us about geriatric services in Barrie. Scott, if that's holding you up, would be about a half an hour on this presentation. You okay to hang around till then?
That's fine. Yeah, no problem.
Okay, great. I know you're busy people, so okay, thank you. Sandra, thank you for joining us. Now, can you start off by giving everybody a little background on who you are so we know what your position is and then what the geriatric services does for us in Barrie. Thank you.
Good morning, everybody. I have a bit of a deck, so I'll share my screen. I'm hoping I'm going to be able to do that. Let me start, see if I can pull that up. How is that? Can you see that okay? We're good? Thanks, Donna. So hi, everybody. Thanks for having me. So my name is Sandra Easton Bruno. I am, as Donna said, the director of the North Simcoe Muskoka Specialized Geriatric Services Program. We are under the lead agency of Waypoint, but we are actually a regional program that does both geriatric medicine and geriatric mental health services in the region. So just about myself, I'm a nurse by background, almost 30 years. I have been a clinical nurse specialist in geriatrics for many years. I was with the LIN, the North Simcoe Muskoka LIN, for 6 years as a senior planner, which really helped build the foundation of this program. And I have been with this program now for 6 years. It is brand new program as of 6 years ago. We were one of the regions in the province that didn't actually have a formal specialized geriatric services program. So we got this off the ground 6 years ago. And in truth, it started at my kitchen table with a phone. So, we've come a long way in 6 years. So I'm going to try and do a bit of an overview of sort of older services for older adults at a bit of a high level, but I am entirely open to stop if Donna, that's okay with you. If people have questions, I think I'm really more interested in generating a bit of a conversation to make sure I meet your needs. So in terms of older adults across the North Simcoe Muskoka region, and this is actually fairly old data. This was from maybe about 2020, I pulled it. I always say seniors, it's kind of the 20-40-60-80 rule. Older adults generally make up about 20 to 25% of emerge visits. They generally make up about 40 to 45% of admissions from an emergency department into a hospital. They generally make up about 60 to 65% of hospital days, and usually about 80 to 90% of what we call alternate level of care or ALC days. So you can see older adults may not be the biggest user of an emergency department, but as they work their way through the building, because often of their complexities of their illnesses, they generally need to stay in the hospital and need more care than other populations. Way back in 2016, the census for the region was 90,000 older adults. I have no doubt that we're probably close to 100 by now. We have at least 7,500 older adults in the North Simcoe Muskoka region living with dementia, but I'm also going to guarantee you it's way more than that because a lot of people are not necessarily diagnosed. Seniors generally, but one out of every 5, 1 out of every 4 will have a fall over the course of a year, and unintentional falls are one of the leading causes of emerge visits and hospitalizations in older adults. In this region, we have a very high proportion of older adults, more than the provincial average. The provincial average, I think at the time, was about 16.9%. So we have, more of a population of older adults. Barrie is a little bit lower because it's a younger population. In the other parts of North Simcoe Muskoka region, so the Orillia, Muskoka, Midland, Penetang, and Collingwood have a much higher percentage than 19. Barrie actually pulls the average down. Within the region, the North Simcoe Muskoka region, because that's the region we cover, it's 26 long-term care homes, and at the time it was over 3,000 beds. We've lost beds as a result of COVID. And just to put it in perspective, we have 4 geriatricians in this whole region for a population size that is fairly comparable to children, yet we have over 25 pediatricians. So that's kind of North Simcoe, Muskoka. I want to start by just talking a little bit about frailty, because that is the population we specifically focus on, is when they sort of hit a certain level of frailty. And there is something that we often use called the clinical frailty scale. It was developed by Dr. Ken Rockwood out at Dalhousie. And you can see that, you know, all older adults fit at some level of frailty, whether it's a 1 to a 9. Generally, the 1s to 3s are the more well-functioning older adults that are still pretty active in the community. 4 to 6s are the population that my team works with, where they're starting to sort of slow up a little bit. They're starting to run into a few problems. They may have a few health issues kind of running on this, just slowing them up. And the 7 to 9s are often later stages where they're really a bit more compromised. Sometimes they need palliative care sorts of supports. It's often a different kind of conversation in the 7 to 9s. 4 to 6s can be reversible. 7 to 9s, it's often more of a kind of an advanced care planning conversation. But to put it in perspective, older adults can move through this. So you may be a 1 today, but then you fall and break your hip, and all of a sudden now you're probably a 6, but with some rehab, you can potentially get back to a 2 to 3. So older adults will move through frailty, but we often use this kind of as a marker when we talk about the care of older adults and specialized geriatric services, which is a component of that I do. We often will talk about frailty, because you'll move through levels of frailty. So when we look at frailty in the province, and this is some of the data that we're seeing coming out provincially, we know that we're going to have a lot more older adults that are going to be frail as the population is naturally aging. So what we're seeing now will only increase in volumes as the population continues to age and as the baby boomers continue to kind of move through. So we, in this particular region, as they've realigned the lens into what they've, what these Ontario health teams, or what Ontario Health now is, we are part of a central Ontario health region, which is comprised of North Simcoe, Muskoka, Central West, Central, and Mississauga, Halton, Lynn. So 4 lands have kind of combined into one now. And in this particular region, we can see that the total estimated population of 65 plus is about 625,000. About 150,000 estimate would be living with frailty. The number of visits would be visits to a specialized geriatric services team, and the trained number of professionals is probably, we need at least 1,000, if not potentially more. And at this point in time, based on a survey that was done, knowing that some teams didn't fill it out, you can see we're sitting at 159. So we're basically the second highest in all of the newer Ontario health team regions, but we really don't have a lot of specialized services in this region. So that's a little bit of a higher level of frailty and specialized services. And when I talk specialized services, I'm talking about the need for interprofessional teams, geriatricians, geriatric psychiatrists. Sometimes you need an occupational therapist, you need some physio, you need a team really working together because the individual is needing a bit more help in the system. So I saw this graphic for mental health and I kind of recreated it for this group, hoping it might help. So when we think about the levels of frailty, you have that well population where really the focus is on health promotion and prevention. I know how to manage my health and what to expect. As you start getting a bit more at risk and with mild conditions, what's really important is identification and early intervention to catch them at those stages, where you can give the individual some of the tools that they need to manage their own health conditions. As their health conditions change, you have more moderate conditions, and that you need more regular provider kind of support. You can manage them, but you might need to learn some new skills and information and work with a team. And then when you have really some of the more complex or severe complex, that's where the specialist teams comes in. And that's sometimes where we focus our attention is on that specialized geriatric services. So if you think about the level of frailty that we just went through, you can see how as frailty increases, the needs will change. And it really is very much like a pyramid. The well population makes up the bulk of what's happening, but as the needs increase and as the complexity increases, there's needs for more and more specialized teams, but for a smaller percentage of the overall population. And there are 4 factors, I got to hide my screen a little bit here. there's sort of three things that I think of. So as we think about complexity increasing, their healthcare resource needs will change and increase. Their housing needs will change and increase, and their social support needs for older adults will change and increase. So if we pick away at one of those at a time, if we think about social supports, that's your families, your friends, your neighbors. So as those needs increase, there's more need for support from that support system that surrounds the older adult, which can lead to incredible amounts of stress sometimes. I know my sister-in-law's parents, her dad has fairly late stages of dementia and is really running into a lot of responsive behaviors. And his wife is a nurse. His wife used to do long-term care down in Toronto, and she's in tears many days. It's overwhelming. She's got lots of different supports around her, but there is a lot of stress as those needs change and increase over time. If we think about housing, and so this is where we think about what services are actually available in the regions. There is a variety of housing. Most people will remain living independent, but sometimes as those needs increase, there might be a need for supportive housing where they live independently, but it's a structured environment where they have more supports on site to do that, or the supports may come into the home. There's retirement home settings, and there's many retirement homes in the region, and that is, there's a financial component to retirement homes. They sort of vary in price. My mom's in one here in town, but retirement homes often will have a little bit more structure. The meals are provided. There's independent stuff that can happen. Sometimes they have assisted living units. Sometimes they have memory units, but there's a little bit more structure and support to that home environment to allow that individual to stay and age in place. And then when their needs get really a little bit higher than that, then they have to go into long-term care. Historically, those were referred to as nursing homes. And we have in this particular region, in the Barrie area, 10 long-term care facilities. And that includes the one out at Elmvale, because that's all sort of captured in what was historically the Barrie region when we talked about it from a LHIN perspective. So we have 10 long-term care facilities. And I think the number of beds was sitting a little over 1,000, if I remember correctly. But as I said, with COVID, and as a result of sometimes some of the changes in the older units where they maybe had more than 2 people in a room and they can't do that anymore, we've lost some beds in the system. So you can see the need for housing increases, and there are a variety of resources and services in the Barrie area to support some of this stuff. And then the last would be sort of that healthcare resource perspective. Primary care runs the gamut of all of them. Primary care is the foundation of our healthcare system, and we sometimes forget that, but it really needs to be. That is the group of individuals that see and follow all of us on a day-to-day sort of basis when that need arises, right? They're the ones that are the glue that holds the system together. But outside of that, there are a variety of other resources that would be available. So home and community care supports, and I'm not just talking the old CCAC or what more recently has been referred to as the LHIN, but I'm also talking about a variety of community support services. There's certainly acute care, so in the Barrie area, that would be RVH. There are specialized geriatric services, and RVH certainly has some programs. And then as those needs continue to increase, then we're talking sometimes those palliative care services. And all of these things are available in the Barrie area in some way, shape, or form. So if we think about the Barrie area and the resources that are available, way back in the 2016-18 census, Barrie region had about 30,000 older adults. So the Barrie region, underneath all of North Simcoe Muskoka, has the smallest percentage population of older adults because there's lots of children, but you actually have the largest volume of older adults just because of the sheer size of the city. So at that point in time, there was about 30,000 older adults. And it's an interesting population in Barrie. In some of the other regions, older adults, you find more older adults who've aged in place or they're relocating up to their cottages. In the Barrie area, many of them have followed their children because children have relocated here and then the parents have followed them. So as I said, in this particular region, we have 10 long-term care homes. From a hospice palliative care perspective, we have Hospice Simcoe up on Penetanguishene Road, which is a great facility. And they also don't just have their building, they provide services in the region. And there's also access to the North Simcoe Muskoka Hospice Palliative Care Network. There is home and community care support services, which was the historic CCAC, more recently the LIN. It's actually called Home and Community Care Support Services now, and that is all the individuals that will come into the homes, PSW support, occupational therapy, physiotherapy. Sometimes they have nurses come in to do dressings, those sorts of things. So that's home and community care support. But outside of the formal home and community care program and system, which we will see change over the next probably 5 to 10 years as a result, 5 years likely, as a result of the changes in our health system, there are a variety of community support service agencies that are available in the region and really important to the functioning of the region. So examples include the Alzheimer's Society or Red Cross or VON, acquired brain injury services, independent living services, CNIB. There's a variety of services that are out there available to older adults. Many of them sort of provide the resources and support. Alzheimer's Society is a great example where, you know, they have programming for older adults with Alzheimer's disease. They have programming for the caregivers of those older adults. They provide education, lots of education to raise awareness. They advocate. So all of these organizations, transportation systems, Red Cross has some transportation supports. So there's all sorts of community support service agencies, Meals on Wheels, that are out there to support older adults. Then there's the community programming itself, which would be the Meals on Wheels. There's adult day programs where VON offers it, Grove Park has a program, the County of Simcoe has one as well, where if you have older adults and the family needs kind of some respite because it's a lot, they will go to an old adult day program where there's programming through the day and they can be dropped off and, you know, the stuff happens during the day and then they come home and it gives the family a bit of a respite. It engages the older adult in activities outside of what would normally be happening in the home, which is a good thing. There's respite services. VON has the smart exercise classes that they offer around the region, which are awesome. So there's all sorts of community programs that are available. In terms of the higher levels or that interprofessional, the team that comes together when you have somebody who's frail and primary care is saying, we're stuck, we really need some help. This is kind of beyond our scope. They have a bunch of stuff that's going on. I always talk about it like a house of cards. You have those older adults who are functioning and all of a sudden you pull one of those cards out and the whole house starts to kind of crumble because of the frailty, and there might be the social situation and maybe some medical stuff and medications and stuff. So in terms of local specialized geriatric services in the Barrie area, RVH has a seniors care unit. They actually have in the emergency department 2 geriatric emergency management nurses who try and pick up some of these individuals as they're coming in the doors to see if actually they do need admission or if they could get redirected out. They have an urgent care clinic that they run out of RVH. And they also have a nurse-led outreach team, which is 2 nurse practitioners that go into the long-term care homes and try and support that population in the long-term care homes. The Barrie Community Health Center, the Barrie CHC, has the North Innisfil service. So if any of you are familiar with Kirsten Mossman, who's a care of the elderly doc, she's extraordinary. She's tied into that program. The Barrie Community Family Health Team has the Aging Well Clinic, which historically used to run out of Little Lake, and now they're down at their main site off of Big Bay Point. And then at Georgian College, there is the nurse practitioner-led clinic, and they have a Wise and Well clinic that they do with Dr. Kim McKenzie. He comes over and helps them every once in a while. At our end, so what we have regionally is also programming that comes into each of our subregions. So we have a what I call an integrated geriatric mental health team. So we have, for older adults with serious mental illness, we have 2 geriatric psychiatrists that are tied to our programming. We have teams that are around all of our regions, and we also are tied and lead the team for older adults with behavior. So sometimes as dementia progresses, they may wander, they may have some aggression, they may have some disinhibition. And so our team will come in, see if they can pattern the behavior, support the caregivers. Specialized geriatric services are often sort of short-term. They consult, they come in, and then they pull back out. We have through the computer, we sort of have an e-consult program for people that maybe don't necessarily need to wait for a referral, but they need some help. And so our geriatricians or geriatric psychiatrists will sometimes help through just a consult on the computer. We have a program that we're tied to provincially called Geriatric, which is great. It's out of Waterloo, Wellington. We were the first satellite site of that, and it's around medication. And oftentimes prescribers will have real challenges when there's a complex medication, or they don't know how to wean them off their medication, or increase the dosing of their medication in an appropriate way. This team will come in, do a full research report, and figure out what the best way to do it is and feed it back as a report to the prescriber. And then we also have our seniors care exercise program that we offer in collaboration with the Barrie CHC, with the Community Health Center. And that runs a couple of days a week. And it's similar to the SMART program that VON runs, but it's for those that have a little bit more frailty and need a little bit more eyes on as those exercises are being done. And then from a health human resources perspective, there are a variety of allied professionals around the region. We do have sort of officially one care of the elderly physician, which is Kirsten Mossman in this region. There is another one, but she was doing hospitalist care over at RVH. And we have the two geriatricians, so Dr. Kim McKenzie and Dr. Java Darwish. So, you know, there's nurse practitioners. So there's all sorts of resources that are out there. I think the most important thing is, you know, everybody always talks about the aging population as a tsunami. And I remember being at a policy session, sorry, dog's going off now. I remember being at a policy session years and years ago, and Michael Rackless, who was a great policy person, talked about the older adult population. It's not a tsunami, it's an iceberg, because we're watching this peak of demographic move. And I remember him saying the only way you get hit by an iceberg is if you don't get out of it in time. And so appropriate planning is really kind of important. So I'm going to stop sharing and mute myself and see if there's any questions, comments.
I have one question I'll start with. You know, with the number of seniors, is the two things, how aware are people of these services? And secondary is they're in ratio to the number of seniors in the area, is the services sufficient? And what can individuals do to advocate for more services? And then Gwen had a question.
Are people aware of the services? I would say no. I think in fairness, no. I think you have some that are more informed than others. Do people know actually the full breadth of services that are out there? No, you see families, you know, it's a bit like me taking, I always use the analogy, it's a bit like me taking my car to the mechanic. I have no idea what happens with my car. I know the healthcare system, I know the questions to ask, I know where to find services, but if I took my car to my mechanic, I have no idea. If they tell me something's broken, I go, I don't know. Most people don't know the healthcare system. So you're not always aware. I watch people struggle. I watch my sister-in-law with her parents struggle. So I'm on the phone with her saying, try this. How about this? What about this? So I think in answer to your question, Donna, I think that there are some people that are more well-informed than others, but I think there's still a lot of lack of knowledge. I also think that there's not a lot of marketing of some of these programs, because to your other point, these programs are overwhelmed. I think I saw Dr. McKenzie last week, or I was on a call with him, and I think he's got like a 9-month wait list. So there's not enough resources to actually see these programs. And so the programs don't always tend to market because they can't serve more individuals. So I think we have a bit of a cycle around, you know, the issues of it. I think the Barrie region is growing. You are more well-resourced in the Barrie area than some of our other historic LIN partners, Aurelia, Muskoka, like you are absolutely more well-resourced than others. There is work going on through the Ontario Health Team, the Barrie and Area Ontario Health Team. There's a seniors working group, and we've got some specific programs and pieces of work we're trying to do there. The biggest problem is everybody always says there's not enough resources, and there's not. But in the same token, the resources don't work efficiently either. So as a great example, we were running a clinic. RBH runs a clinic. The family health team runs a clinic. The Georgian nurse practitioner runs a clinic. And sometimes what was happening is individuals, because nobody knew where to refer, would refer to all of those clinics. So one of the pieces of work that we're trying to do through the Ontario Health Team is actually integrate these clinics so that the people are going kind of in the right direction based on their needs. So I think there's a lot more work we can do as individuals. We certainly need to advocate. Just a second, sorry. Sorry, as individuals, we certainly need to advocate. We need to do more as a committee of the council, of the Barrie City Council. I would strongly advocate for this group to come together and do some collective advocacy around how do we actually build. In some regions, municipalities have done some of the building of the local geriatric services. You know, we've talked in this region, and I know as a first step in integrating these various clinics, because there's no point in having referrals going out to 3 different clinics and people waiting for 3 different appointments and taking up 3 different spots to have the exact same thing done. So we need to make that more efficient. But as a next step, what we ideally would like to develop in the Barrie area is a geriatric day hospital, where it's a one-stop shop where the clinics are running. You don't need to go into RVH for an urgent care clinic. You know, when you think about older adults, especially frail older adults, it's incredibly convenient. And the hospital, I love that the hospital runs it. I used to work at RVH and we built some of those clinics, but you don't need to go into a hospital for a clinic. You got a frail older adult who's got to pay for parking, make their way through the building to actually get to the appointment. Half the time, by the time they get to their appointment, they're exhausted because they got to hook their way through the building. Like, there's different ways we can actually deliver care in the region if we partner in a bit of a different way. Is there a building? When I was down at North York Gen years ago, they used to have a building and they ran all of their clinics through there. They ran their exercise programs. They had a woodworking class. You could run an adult day program in there. Like, you know, really collectively, how do we work together? There's great programs through Parks and Rec in the city. You know, how do we partner into them? There's the new YMCA that's going to be getting built downtown. How do we partner? I think they were having a bit of a seniors focus, if I remember in my last conversation with Jill Tetman, right? How do we actually partner together in a different way to make the best use of the resources that we do have and continue to build and grow them to support the needs of our older adults across the Barrie area?
When did you have a question? And then
A couple, if you don't mind. I just wanted to verify the 30,250 age 65 plus, 12,985, 75 plus. Are those up-to-date numbers?
No, those are a little bit old. Those are the ones I had in my deck when I'd have to look to we'd have to get the numbers from the Barrie Ontario Health Team. They've probably got more current ones, but I'll guarantee you it's more than that. Not a doubt in my mind.
I remember years ago being in Toronto at meetings where they spoke about the need for more geriatric doctors, and apparently nothing has happened there. I'm aware that 99 Ferris Lane between Bayfield and St. Vincent's is about to become available. That big building and lot, I mean, that would be an ideal place for a geriatric day clinic, just so you can put that down, and it's not all that far from RVH. I really, really like the idea of the geriatric day clinic. For seniors going into emergency and having to wait 8 or 9 hours to be seen, I don't know whether that's Barrie numbers, but I know what happened to my sister-in-law down in Hamilton. That's unconscionable. And we need to do something about it, and maybe some of them could be diverted. And I'd like to talk about that further with anybody that's interested. Thank you.
Anne-Marie?
Thank you. It's so good to see you, Sandra. And I was sitting as an attendee, so you didn't see me in the beginning, but if I did miss it, I also wanted to make sure we highlighted the websites that the Specialized Geriatric Services runs and just the amount of resources that you put out, and as well as the relationships with Amica and some of the partnerships. So what Sandra is also doing with her team is quite incredible for this region, and it was some time coming, but we're quite fortunate to have her. And I remember the days in which it was difficult to even acquire the geriatric services that we have now and maintain them. So a couple of questions that I've got. One was you were talking a bit about primary care being the backbone, and I'm still getting many residents, even from a municipal side, moving into Barrie and looking for physicians. I didn't know if advocacy tied to unattached seniors was still important. If we're seeing seniors are pretty well attached because of that demographic, if it's prioritized in any way, or are we seeing seniors becoming unattached or having difficulty maintaining or acquiring a primary care contact? Is that anything in the system that you're seeing at all with some of our frail or vulnerable seniors?
Was that a question for me, Anne Marie?
Yeah.
So a couple of things. First of all, don't go to our website right now because it's under construction. So if you go there now, you're not going to find any resources. We're in the middle of changing it up. In terms of primary care, there are certainly, I think we'd have to look to the local Ontario Health Team stats. They would have the stats around unattached. What I think might be really valuable would be to have a cross link between this group and have a representative on that Barrie area seniors group. And then there is that flow of information that goes back and forth. So that might be something to think about because they're always looking. I mean, it's really important that whatever work is being done is being informed by older adults. So just one thought. So I would think we would have to go to them, but I think we have a couple issues with unattached, right? So you've got those in the region that have no provider, but then you'll remember me saying early on, there's a lot of older adults that are relocating to the region to follow their kids because the kids have moved. Sometimes they do have a provider, but their provider is in Hamilton or their provider is Toronto and they can't access them very well. So, you know, it's always an issue. I know up in the Aurelia region, one of the things that they did for palliative care, and I think they're doing it for older adults, is with one of their teams, they've tied like a nurse practitioner then who can pick up and do some of the follow-up, right, with some of those unattached patients, because otherwise they end up in your walk-in clinics because that's where people will go, or they can't get into they may be attached, but they can't get into their primary care provider in a timely fashion. Most are quite good, but there's somewhere if you can't get in, then they end up at the walk-in clinics, right? So, you know, I think there's always work we can do around primary care. When you referenced the geriatricians earlier, and it's not just the geriatricians, but will be the geriatric psychiatrists too. There's never enough of those. And part of that is a national issue in terms of recruitment. Part of it is tied to remuneration for those docs. They don't do well in a fee-for-service kind of model, because if you were an orthopedic doc, an orthopedic surgeon, let's say, you could see 8 people to 10 people in an hour, look at their x-rays, kind of go, see what's going on and move them all through. So fee-for-service works really well for some of those. It doesn't. It can take me 2 to 3 hours to see one individual, you know, when I was doing clinical care. So sometimes it doesn't pay. There's a bunch of things that go on. And in terms of emerge visits, 8 to 9 hours is way too long for older adults to be waiting in emerge. Sometimes that's tied to volumes. We have that compounding piece with COVID right now, which really isn't helping. But sometimes they actually do need to be in there for that period of time. Because, for example, if there's any concerns around cardiac issues and they're doing, let's see, some cardiac enzymes, there's actually a period of time they have to be there for that lab to be done and then repeated again. So sometimes there can be reasons for them to be in there longer, but 8 to 9 hours, some can be in there for 2 days before they sometimes get a bed, right?
It's 8 to 9 hours before they're seen.
Oh, yeah.
Molly, Molly, you
There,
had,
Donna, we do have Paulette also who does have her hand up, but you can't see that.
okay, so Molly and then Paulette, and then we'll have to, we need to go on talking. We have a lot of issues to get through, so.
Donna, can I just finish on a question that I had tied to my original that we segued? Because the question about physicians was also more about, as we're going out and this committee has plans for town halls and communications, are there themes tied to that? And whether it's answered today or offline, would be great to hear if we should consider some themes or key messages to seniors as we're engaging them. But to the point, it would be great at some area. My assumption would be, Sandra, to the point of getting some type of cross communication. This group's term is up in November. So I'm assuming it might be timely and strategic for the call out for membership to this future committee actually going to the membership of the senior subcommittee of the Barrie Ontario Health Team? Or should we be pushing for some type of membership sooner that just migrates into the next term of council? Is there a concern with delaying?
I would encourage if there's a way to put a member in there now and then the member just changes when that time comes. I think the sooner there's a voice at a table in terms of supporting planning, the better. Sometimes it's helpful to have somebody who understands the system a little bit, because I'm going to tell you, we use a lot of acronyms and we talk really fast, and sometimes that can be a challenge. But I would say the sooner you get a person in there, then planning is truly being informed by the people that are the users of the system.
Mhm.
Okay, thank you.
Good point. Okay, Molly, and then Pat. Go ahead, Molly.
Thank you. I have many questions, but I'm concentrating today particularly on home care. I had a PSW recently, a few years ago, who did not know how to make a bed. The next one I had told me she had graduated a month previously, and I let the service that employed her know that I was doing a lot of on-the-job training. I currently live in the Life Lease section of Victoria Village, and somebody came into our building yesterday and came out again, and she said, "How do I get in? I'm a PSW." So I showed her the interphone system. Well, she only had the first name of the patient, which was no help at all. And this does not seem efficient to me. There should be a great amount of room for improvement. I saw her leave the building, and from her body language, I would think she was very annoyed. So I suspect she had not been able to reach the patient. What condition the patient was, God only knows. In this case, we are an independent living. We had, in January, a resident was found who had died in October in her unit. Less than 3 months later, another was found in his unit. And I'm querying the possibility of a third, and I'm told individuals have the right to live and die as they please. And the government has no jurisdiction that allows them to intervene if people haven't been seen for a while. Now, all that, I think, needs one hell of a lot of improvement. Thank you.
Pat, did you have a question?
Paulette?
Yeah.
I do. I have I had a friend. She passed away yesterday, unfortunately, and she was going to be seeing one of the doctors, and I thought it was at a clinic where these doctors only see seniors, and you have to be referred to by your doctor. She was referred, but of course she won't be going now. Is there not that, I'll call it a clinic in Barrie?
Yeah, so that's the ones I was talking about. RVH has an urgent care clinic.
Okay.
The family health team has the Aging Well clinic, and the Georgian Nurse Practitioner-led clinic has Wise and Well clinic. But that one is really a little bit more of an offshoot of Dr. McKenzie's office. So there are those clinics that are out there, but it can be a bit of a wait sometimes.
Yes, that much
problem. That's the problem.
Yeah.
Yeah.
Yes, for sure. Thank you.
Great. Thank you so much, Sandra. That was an excellent presentation. I'm glad that we were able to have you come and present for us. If it's possible, can we have a copy of your presentation? Really would appreciate that. And if we have any other questions, I'm sure we'll be sending them along to you. So thank you again. It was excellent. Lots of food for thought. Thank you.
Thank you for having me. And if there's anything more, Donna, that I can do or group, I am happy to come back and provide support. Emery knows how to get a hold of me too.
Yeah, I think you've given us some good ideas. Thank you.
Okay, thank you. Bye-bye.
Okay, bye-bye. Okay, thank you everybody for participating in that. It was a great discussion. Okay, so our town hall meeting that we want to have in June sometime. So Scott, maybe you could help us. Were there any venues that were possibly available?
Well, I looked into the idea of this hybrid approach that I think the committee was looking at, where there's an option for virtual and in person. It looks like it's going to be there's a bit of some issues with it, where I mean I think that first of all, the only venue that we think that we could actually do something hybrid would be in the council chamber, like they do on Monday nights. But even with that, you can't control, if it's a town hall, how many people are going to be attending in person. And so when we started thinking about it, it's like you could fill up the town. I mean, maybe you get too many people and then you have to turn people away. And so it's not the best option probably for a town hall. I was thinking that, and that's up to this group, that probably the best approach would be to either just do it strictly virtual like we've been doing, but I know that was ideal because we weren't getting a lot of turnout to a virtual town hall or something like that. But maybe if you did something in the park or some, would that be an option, just to do something in person where you have people come out to a park, and you could even offer some kind of programming if it's just turn it into a little bit more of a social event too. At that point, it's like it's safer, and you could have choose a park in one area of the city for June, and then maybe in October choose a different one. And you'd have to have a rain date, of course, because we'd be at the mercy of Mother Nature. But I don't know. I was thinking that might be an option, just to avoid doing the virtual again.
Mm-hmm. The rotunda at City Hall, that I guess that is an area that you really can't use. I know they've had jazz festivals and other things in the rotunda. They've also had other speakers. Is that
we could we could use it, but it just wouldn't be. We wouldn't be able to do the virtual option as well. It would just be in person. Yeah,
I'm thinking more of accessibility for people.
Right.
And that it's an area they know, people would know and be familiar with. And I'm not sure. So what does the committee think? Heather?
If it's not virtual, then either of the 55 plus centers, there could be space made available. Having said that, it's kind of important to have this information today, if possible, simply because I have a deadline of this Friday to get a memo together to my manager, who will go to City Council. So anything we decide today can go directly from my desk in a memo to City Council that they will read out in the first Monday evening of June. So yes, if we're not looking at a virtual option, then the main hall at Parkview here holds technically 170 people. That's pushing it. Comfortably about 100. And the Allendale main hall holds a few more people, as many as 225. However, again, comfortably about 150 to 170.
Yeah, and that's just, I guess, assuming that, I mean, do we think that everyone's going to be comfortable with going back in person to a town hall? Because I know that was the thought with having both options. But if you're just in and outside was, and I know that maybe the accessibility might be a challenge, but we'd have to try and find a park that would be accessible. But that was kind of the compromise I was thinking, was it would be, people might feel safer to be outside, but totally up to this group to.
And for June as Recreation Month also, the City of Barrie is partnering with the Barrie Public Library and a couple of other partners for an outdoor wellness clinic. I just became aware of this over the weekend, so I've not been included in the planning on that. It would be, I think, it has a different focus to my understanding. It's more related to the, sorry, I'm gapping the words here, and Marie, maybe you can help me. The clinics downtown. So that deal with folks who are overdosing. I'm not using the right language here, but it has a different focus. But it again is using the Meridian Center as a place for the community to gather, and it's a bit of a town hall, healthy living fair, some activities. Recreation is running some activities, but then there's information sharing about the sites that are being considered in the downtown area, to my understanding.
Okay. Molly, and then Gwen, do you have comments? Molly?
Thank you. I think there are some very significant things that need to be considered if you're looking at a venue. It has to be on a bus route. If it's virtual, you're going to lose a lot of seniors who can't use computers for virtual meetings. And you also need a lot of seats, because seniors need to sit down.
Right. Okay.
That's what I would advise. Thank you.
Gwen?
Well, before you mentioned Allendale, I was thinking high school gymnasiums, because we were going to use one just before COVID for our last big event. But what about Meridian Square? It's open air, it'd be on bus routes. It's certainly central. I'm just thinking of a place that everybody might be aware of. Just a thought.
Yeah, I'm just going back to what Molly said about seating. And while you have some seating areas, they're not actually in a meeting type format. They're more open, and people might have to bring their own chairs. So that might be another issue. The other thing you compete with at Meridian is traffic or noise surrounding Meridian Square if you're trying to converse with people, which can make it sometimes a little awkward.
And
So-
adding to what Molly was saying, washroom facilities are important also. So that would eliminate like Sunnydale Park, for instance, or many sites. Yeah.
I think that since this is our first, and we plan to have another, this would be a good test to see if people are really interested in coming out. And I personally think the Parkdale Center would be the better location, because it is on a bus route. If you did want to sit outside, there's the park area behind the Parkdale Center that people could sit in if it's a nice day. But then you'd have to take chairs and everything outside. You also have a kitchen, right? So if
yes, it's full facility. So there's washrooms up and down, and there is the shelter, as you say.
So if you wanted coffee and tea, or you want to serve something, you've got a facility.
Or if there's cold, yes, like I would suggest something like a cold drink rather than food sharing. We're cautious about food sharing even now. We're not currently offering our regular food sharing or food services. Yeah, but like a water, cold drink, something can certainly be facilitated through a kitchen. Yeah.
Paulette has her hand up. I'm not sure if it's still up or if she needs to speak.
Paulette? Okay, go ahead. Paulette?
That was from my last question. I guess I'm not sure if I'm supposed to shut it off after I speak. Sorry.
Molly, you had another question, another comment?
Yes, I do. The noise factor, I forgot to mention, because so many seniors have hearing problems.
Yeah.
And to have anywhere outside, I think would be disastrous, particularly if there's a noise factor.
Okay. Anne-Marie, did you have a comment?
Thank you. I'm going to loop all the way back to whether or not this is what you meant, Heather, about the event being arranged. I've asked Brandy to send the link, but the Barrie Public Library is having a Seniors Day on June the 11th. There's information on that. It's being held at Painswick, so at that branch. And the theme is stay active, connected, and safe. So I don't want to take away from a really great event we could run and plan, but I'm also June is really around the bend. Would it be of interest to the group to reach out to the library and actually see if we could partner in on this? So whether or not we're available on that Saturday or running it, we could maybe include or add information that they could put on the website potentially under this, questions where we might want the link to a survey, or maybe also just include or have a station at the branch for longer than just one day. So there could be opportunities here that lend themselves for us to facilitating maybe an easier way in which logistics could run for our first event.
Okay. That's a possibility. Maybe we could jump to the question of communication, and maybe Scott could help us out with this. We do have our banner, and we do have our cards that identify this Seniors Advisory Committee. So if we were going to have an event, what sort of things would the city be able to help us with as far as communicating the event?
Yeah, for sure. I mean, we would communicate it in the Barrie Advance and This Week in Barrie, and we'd have it on our website, and we could do a media release to all of our local media. But to Councillor Congo's point, if there's an event happening, it would be easier to, partnering with the library. They'd also be promoting it, and we could help cross promote it to different audiences. So that would also be a benefit to doing to tagging off an event that's already taking place. And I think that if there's an event happening on June 11th, then we're going to try and get people to come out a week later. There might be we're trying to get the same audience, and we might be losing some people. So
okay. Heather, you had a comment?
Yes, thank you. The 55 plus centers will also be offering a couple of events. I really love this idea from Anne Marie, the Barrie Public Library one, because it captures perhaps a different audience. But there is an opportunity to participate either in a kind of booth or a survey getting out to a wider audience. Should you wish to participate, there's an open house that will be held at the Allendale 55 Plus Center. The date is pending. However, a possible potential date of June the 15th on that one. And that's at Allendale. And the Parkview Center will be holding a similar event on Thursday, June the 9th. So there are sort of Seniors Month events that will attract seniors. The focus is having fun, participating in the community, getting active again, getting out, and it's called It's Time. It's time to regroup, and be together and enjoy each other and just have fun. So the focus is not so serious in terms of speakers and those kinds of things. It's more on participation and just coming out and enjoying some playtime, really, with friends. Yeah, for older adults.
I think there are so many events going on that to have another one by us might not attract people because they would have already attended another event. But it would be really good if members of the committee had a table and could attend each one of those events. That would expand the number of people that we would actually make contact with, which would be absolutely marvelous. Yeah, I think that's a great idea. I don't know what other people think. Pat? Pat? Yeah.
I agree. It sounds to me like there's enough things that we might be able to partner in on rather than planning our own event. It would just be redundant. These events are already happening, and if we could get something where we could just help participate, that makes much more sense to me.
Okay. I still think we need to plan, because we still need to say, okay, we're going to be June 11th, June 9th, June 15th at these events. Who from the committee is available? What goes on the table? What are we going to promote? The other thing we have to look at is questionnaire, and whether we
Can't hear you, Donna.
Sorry, we have to look at the questionnaire and confirm that this is what we want people to fill out and write some response to. So that's the other thing. And then talk to Scott about possibly, if this is a worthwhile questionnaire, seeing whether we could get it online for individuals to respond to as well. It's not as specific as the age-friendly plan. It's more just to get an overall consensus of the people that are and what they're concerned about, and then go from there to show that we as a committee are also interested in that. So, goodness. I think personally, and maybe we can get an agreement from the committee, that we should attend all 3 events rather than having a separate event. Does everybody agree on that? Okay. Then secondly, how do we go about getting a table and communicating to whoever's having the event that we want to participate as part of the event? So how do we go about doing that?
With the one on the 9th and the 15th, Heather, is that just through you?
It's
Right?
done. You're booked.
Yeah. And then it's probably finding a contact at the Barrie Public Library around how we might be able to be present and just getting their support for that.
We did have a lady, I can see if I can find her name, that attended one of our meetings. So I have no problem with checking with the library and finding out how we.
And if your facilities, Heather, you would have table and chairs, we wouldn't have to bring anything.
Yeah, no, you wouldn't have to bring anything. We have tables and chairs. I probably have, some really nice display things to assist with the display, like a tablecloth that says Barrie, with the Barrie logo on it, and that kind of thing. So, and
we have our
materials.
screen. Yeah, we have our screen, and who's got all of our cards? I know that Jessica had them. Do you have them, Heather? Do you have all of our promotional cards?
I'll ask her. I'm still digging through finding everything here at
Jessica
can tell me. Yeah, I'll ask.
Yeah, so we will need those cards wherever they are.
Okay. Are they business cards, Donna?
No, they're probably a 3x5 card.
Okay.
With information, just Seniors Advisory Committee, phone number.
Okay, a rec card, yeah.
Like a rec card, yeah, exactly. And
do you want us to sign up through Brandy just by email? Like, for instance, I can be there on the 9th with others. I can have a laptop and pull up anything that's also online in addition to hard copy. We can set up the banners, and then I can even when we're done, if Painswick can take it in advance, I can actually drop it off to the Painswick branch that day, so they have everything there on the 11th for whomever could go to the Barrie event for the library, and then it might just be whomever is kind of connecting then with the event on the 15th, arranging their own handoff of the supplies.
Well, what I'll do is I'll circulate an email and ask everybody to just put their name in the email in whatever meeting they're available. Now the question is what time are these events? What time is the event running from to?
I believe mine is the 2 are either 9:30 or 10 a.m. start times to 1 p.m. So it kind of covers off.
June the 9th is 9:30 to 1?
Yes, I believe so.
9:30 to 1, and the 15th?
Can I send you the information, Donna?
Yeah, because I think people they'll need to know that before they can confirm they can attend, right?
Yeah.
Now, Scott, you could help us with this. How do we get our name attached to the event so people know that we'll have a table there if they're interested in?
Well, I think we'll be promoting this already, right, Heather? And so we'll just make sure that we add in a line that's saying that the Seniors Advisory Committee will be in attendance. So our group will be our department will be responsible for getting the word out about these events anyways, if they're taking place. So we'll just make sure that we incorporate that into our promotions.
Okay. And so the library one, I'll talk to the library individual.
Yeah, for sure.
Get back to you on that.
Perfect.
Okay, as far as the questionnaire goes, what did everybody think about the questionnaire? I don't
Can't hear you again, Donna.
The questionnaire, it was made so that it wasn't a lengthy questionnaire. Most people don't like filling out questionnaires. I think the more critical questions is to get people's opinion on what's important to them as far as what seniors need in the community. So if we can at least get that from them. The other thing is if we have people at the table, they can help. We might need some clipboards, right? So I guess the question is Heather, do you have any clipboards?
I have lots, lots and lots and lots.
So then for printing this, we would probably need some kind of a header on it or something, right? And then the questions below. So how do I go about having someone look at printing this document for these events?
Once it's solidified, you can, for the two Berry site events, once it's solidified, if you send it to me and with whatever header this this committee has, I can send it down for printing at the print shop, at City Hall.
Okay,
and
so I guess
as many printed as you wish. It's a 48-hour turnaround time.
Okay. So as far as the header goes, I need to see, we'll have a copy of our rack card. I'll take a look at that and see what we used on that as sort of a header to label who we were.
Donna, do you want to send it over to our department and we could quickly just brand it with we could look at kind of what was probably done in the past and make sure that it's consistent, look, and then we can send it down to the printer once everybody's happy with it.
That's perfect. Okay, so I'll get that off to you right after the meeting and you can have a copy of it. And any suggestions would be great.
Yeah, for sure.
And we'll go from there. So we have the location, the dates, the materials for presentation, the advertising, we know what will be done. We have our questionnaire. Is there anything I have missed?
The questionnaire, and then once we're okay with the questions, I can put it into a SurveyMonkey, and we can promote that virtually as well, just to give people an option to fill it out virtually. You'll have to manually add your the hard copy ones that you get, but we can figure that out afterwards.
Right. Okay, great. We actually was thanks to Heather, she had mentioned about putting a link to the SurveyMonkey on the bottom of the questionnaire if we had one. So for people that maybe don't want to fill the questionnaire out there, want to take it away and do it at home, they would have the link somehow to be able to do that. So if you see the questionnaire with that on the bottom, that's what it's about. Okay.
We can do that. Yeah, no problem.
Okay. Let's see.
So it might be an interesting metric too. So not a point of information we're giving, but maybe something we're taking to consider that I've always seen to have value is just a quick tick box or recording of the number of individuals we're in contact with, where we've passed along a communication or we've basically had an indication of number of individuals we as a committee interacted with across these 3 days. And in addition to what questions are we getting from them? So is there a theme that that's not being captured in the survey, but is specific to something that they're asking? And we might have to refer them on to someone else, but what's top of mind for these individuals?
Yeah, there is a question, an open-ended question where they can make additional comments. So we're hoping to capture anything we've missed on that one line, which is exactly what you're saying. So great, Pat.
Well, I like Anne Marie's idea because it addresses whether or not we're having any value by having a table there.
Oh, I know, but you're counting the number of people. So we
Number of people and any questions that, maybe they're not related to the survey and there's something, the seniors have questions about that we haven't considered.
Yeah. So to count the number of people, I know that some tables will have a form that people can just put their name and contact information.
Yeah,
So,
and it's not even personal information. This is really just a lined paper where whomever is at the table is just kind of
Picking off
putting a
on-
notch down, and then, ooh, what question was I asked? And then that can come back to kind of say, do we need to start asking this, or does anyone, if it relates to the library resources or not, is that even good information to share forward?
Okay. So I can draft up a sheet and send it around, and then everybody can comment on it. Just something simple saying how many people attended, any questions asked, and then whoever's sitting at the table can fill it out and note how many people they talked to. Great. Now I was going to suggest, since we're not meeting next month because of Victoria Day, that maybe we could look at a subcommittee just to finalize all of the information that we want to make sure we have in place for these three events. So I didn't know if anybody would be interested in just getting together after this meeting, maybe in about 2 weeks, to confirm everything that we've got going here and make sure that we're ready and for our presentation. And by then we know who's going to attend and who's not going to attend a meeting. Is there anybody interested? No?
Depends on the date. I've got my political forums on May 16th. After that, I've got time.
Okay. Well, the first event would be June the 9th. So I was thinking that maybe as just a subcommittee, we could get together. Maybe we got Victoria Day on the 23rd. Your forums are when?
Monday, May 16th.
Okay. Let me think now. Do we do it sooner than later? Like maybe the week of 9th to the 13th of May? That gives us 2.5 weeks to put everything together. So I'm thinking maybe somewhere around the 12th of May. Would that work for us to do a quick review and make sure we have everything in place?
Yeah.
Maybe it's good to proceed with
Yeah,
who you can get, because again, it depends on time. But
Right.
at least I can email and say, happy to debrief. I can commit to being present on the 9th, and then I can connect with anyone as things are finalized.
Okay, so I'll put down the 12th, and then I will send out an email and see who can quickly debrief with us. And then from that, we can send out just some information saying this is what's been done and everything is in place. And these are the people attending which sessions. And then by then, Scott would be able to tell us about the questionnaire and the survey, and that would get everything that we need ready for the meeting. Okay, so we just want to be prepared because it bodes well that we are, if we're going to have a table and we're going to say to the public we're going to be there, that we're ready to meet the public, which would be good. All right, any other comments, questions?
I was just going to say, if the 12th doesn't work, because I'm out of town on the 12th doing a panel, but I could do a couple hours the morning of the 9th if you don't have enough people.
Okay, well, let's write down the 2 dates and we'll see which date we have the information available. And if we don't have it available on the 9th, then we'll talk on the 12th, okay? Yeah, hopefully we have it by then. All right, does that give, Scott, does that give you enough time to review the questionnaire?
Yeah, for sure. When was I going to make the questions? Just to confirm that.
I'm going to give you the questions right after the meeting. I'll send them
perfect.
over to you. And I just received your email. Or Brandy. Brandy, are you there? Brandy, do you have a copy of the questions?
I will definitely check my email because I did see the correspondence going back and forth with the committee.
Because I don't have Scott's email, so maybe you could forward it to him.
Yeah, for sure.
Yeah, if not, let me know and I'll send you another copy, or I'll send you another copy. Just
Perfect.
Sounds good.
Pat?
There was just, I think Molly had kind of suggested one more question and I had put a little addition onto her question. It was just about how people communicate if they don't use computers. And I don't know if that got added to the questionnaire.
Yeah.
I didn't have a really format for it, so.
Yeah, I did add it.
Thank you.
Yeah, so we put down the different methods of communication and then said none of the above, why, or other methods of communication, okay? So we did add that on to clarify.
Perfect, thank you.
Yep.
And that updated part was that sent to me as well? And then I can forward that off to Scott?
I believe it was, but I'll give you the final copy just to make sure, and then I'll get that right to you.
Okay.
Great. Okay, thank you, everybody. That was a great meeting. Yeah. So I think we're organized. Anne-Marie?
Sorry, I was jumping in. As you said, it was a great meeting. I didn't know if you were closing off the agenda. I had a quick question for the committee about something coming to general committee tonight.
Yes, we actually have to go around and just go through everybody to give us an update, and that would be our last thing. So let's see. So we've gone over everything for that. Yeah. Okay. So maybe we could go around and see if anybody has any updates in their own areas. Molly, we can start with you. Any updates, Molly? Can't hear you, Molly. Molly.
She may have closed off thinking it was the end of the meeting.
No, I'm still here.
Yep.
Okay.
I have none. I have none.
Okay. All right, Gwen.
Well, just as I said, I'm doing a housing panel on May the 12th, and of course, the 2 political forums on May 16th. And those are keeping me busy.
Okay, great. Pat, did you have any updates?
Not really. I'm going to be finishing work again for the 4th time on May the 4th. So then I will be more available. I need to contact Heather because I haven't heard anything about the advisory committee resuming at Parkview, but hopefully I can get back to my normal life soon.
Okay. Heather?
Yeah, thank you. We are open and running at both centers. We've got lots of recreation programming now, and we're adding, continuing through. And please keep checking the website for our newsletter and our calendar. For May, there will be some added classes and added programming for older adults, both in terms of fitness and wellness programs, as well as social programming. And June is recreation month, so, and it's also seniors month. So lots going on, and we are planning those 2 events to bring people back out and into the centers. It's time to celebrate and to join in community again. So that's what we do best, and we're going to really have some great events both at Parkview, 55 Plus, and Allendale centers in June.
Great. Okay. Let's see, Evan.
Thanks. We are starting to think about getting back to in-person programming indoors. We are running some outdoor programming. We have a walk and talk group that meets. And we are also going to be running a table at, there's a Wasaga Beach Active Seniors Expo happening in June. So we will be tabling there and hopefully making some community connections outside of Barrie.
Great. What date is the Active Seniors event in Wasaga?
It's Wednesday, June 22nd from 10 to 2.
That was a good event last year, apparently, and they had a good turnout. Was it last
Okay,
year?
great.
I know they've had good turnouts at that event, so, yeah. Okay, let's see, Anne Marie.
Yes, thanks. I've got a couple of updates, but I've got a question for the committee. So the way in which the action that we identified to look at a seniors category of the Spirit Catcher Award got relayed as a senior/caregiver. Now, I thought we removed caregiver from having to be part of the criteria. I am looking to make that amendment tonight, but I want to make sure this committee is aligned so I'm not mistaken. Can I remove reference to caregiver?
Yes.
Awesome.
Everybody
Thank you.
Yeah.
I'm seeing head nods. Great. Second, on that point of note, Evan, whether it's to this group or myself directly, let me know if there's any communication about Gilbert Center being there on the 22nd, because I know our networks are much broader than Barrie too. Happy to promote that and get that out, because I know it's always viable to kind of venture off into the region and see where you can find some of these conversations.
Sure, I don't have any advertising for it. I do have the contact info for the person coordinating it. So if anyone wants that, I can send that along.
Awesome. Or
Okay.
if it's anything on the Facebook identifying that you're going to be there, I'd be happy to push that out too.
Okay, not yet, but I will for sure.
Awesome. And so
Thanks.
two kind of questions, and maybe it's for the next agenda, Donna. One is based on Sandra's comment about sooner than later, try to get somebody from this committee onto the Barrie Ontario Health Team Senior Subcommittee. Should we have a conversation about if someone from this group is interested? Sandra's already given me a contact we can reach out to, but I was wondering about where we would like to discuss next steps about whether or not we want to proceed and or formally identify that we'd like to see some type of connection to the municipal committee for seniors to the Ontario Health Team Committee. Or do we just want to put that on a future agenda for dialogue? If we're not meeting in May, it might push us right before the summer break. And then we're looking at a fall just before the new term of this committee would take place.
Comments?
So yeah.
Any comments from anyone? Pat?
I actually thought that they were talking about having someone from their team on our committee, not the other way around.
I thought so too. That's why I asked the question about should we just ask someone that sits there to join now? If we change our membership, and I'd have to look to Brandy and to the clerk's office. If we're at our membership, usually that's a motion to council, but maybe we want to consider formally making a connection with that Seniors Ontario Health Team group. And if we want to ensure a representative is invited and specifically holds that lens, we add that specific member type to our committee. For instance, I've seen that on other committees around the Sustainability Committee has someone from Living Green specifically. So there's always a connection, not to the person, but to that table. So maybe we need to decide.
I think that's important. And when I was, when she was talking, one of the things I was trying to think about as a committee, how can we advocate with the city more effectively about building these services in Barrie, because it is healthcare. So city is not really healthcare, but still it is something that impacts the citizens of Barrie, and housing is an important issue in relationship to that, which is part of what Barrie does planning for. So I think that's a connection we really need to build in order to develop the services that the part of the services which would be in the healthcare field for the residents of Barrie. What do other people think?
I agree.
You know,
So Donna, if you're aligned, then as a next step, do you want me to send an email connecting you and I and a contact to that committee to see if they would be support on their end? And then maybe we can look at formalizing that membership now or later. But if something could be done now, formally or informally, at least around a guest for the remaining part of our meetings, if we do find we have to structure it and we lose time to do that through council.
Yeah, I think that would be good. I think what would be a great thing to have is that, like, at the end of the meeting, we do an update on what's happening. It would be great to have someone come to the council to give an update. So if the time that the individual has is precious, even if they're coming to provide an update on what's happening in that area to the committee so that we can ask questions, I think that would be very beneficial. Yeah, I would say yes. Okay.
May I speak?
Sure, go ahead, Molly, and then Gwen has her hand up.
I think it's particularly important that it be a member of our committee that is on theirs, rather than the other way around, because they will not be as interested in all the rest of our discussions, and we will be interested in theirs because it's to do with health. I think it would be very good to have a senior represented. Thank you.
Yeah, we'd have to review their term. They'd have to explain their terms of reference as far as how they select committee membership, because I probably, like our committee, have it defined as to who can be a member of their committee. Mind you, some committees have not a committee member, but allow you to sit in and listen. You can't participate in voting in that, but you can participate in hearing what's going on. So there's associate member or whatever. So we could look at it both ways. Yeah. Okay, that's a great point, Molly. Thank you. Gwen, you had a comment?
I didn't want to sidestep Lucia and Paulette, but I just wanted, before the meeting's over, I've had a number of inquiries from students who are not students, seniors who are really in desperate need of housing. And so I'm wondering about the home share program that we previously had for students and seniors. And I don't see why it couldn't be activated to put seniors with seniors. And I'm just wondering if we should look into that. I did send an email to Lauren Wild yesterday. She'll get it this morning, because I know she was part of the home share originally. But these people are desperate, and I think we need to do something about it.
All right, I think the issue is the affordability, right?
Yes, because they can't afford an apartment, but they could pay board of up to a certain amount.
Can I speak to that quickly?
Go ahead, Evan.
So I know that there is a women's senior housing share group. It's called Senior Women Living Together. Their website is swlt.ca. I don't know about any other housing share programs, but I know that that is one that is a pretty inclusive group. They have different regions that are active. So if anyone wants to check that out, it could be an option to refer people to.
Yeah, I've actually looked at that website, and they match people. You go in and apply, and then they'll try to match people with other people. I think what Gwen is thinking more of is that we actually have designated spaces. So if you had, I don't know, if you had an apartment that had 3 bedrooms, that somehow the idea of promoting 3 people in that unit to share the cost, as opposed to one person having to bear the burden of that alone. I don't know, Anne Marie, you probably could help us with it. Is that home share, is that something that I know the city put out that new program of building suites, but I don't know that there was that much in home share or communal type living in that. They've done additional suites and that in homes and then attached to homes, but I don't think the city's doing anything in regards to helping individuals share homes together, right?
Yeah, so you've got the affordable housing strategy with more updates coming, but outside of the county, I mean, the only thing that comes to mind is going back to Georgian College. And I recall the presentation. So while I think, Gwen, you said you went back through Lauren Wild,
Yes.
she probably has a contact, but that gentleman, I think, presented to us when I first started on this committee 2 years ago. And there was some privacy, I think, concerns or just around how to match pre-COVID. But I was under the impression that as things started opening back up, they'd be looking at that. So maybe there's also a direct conversation. My assumption is it's sitting more with Georgian College to maybe initiate forward. And Lauren will probably either give us that contact, but it would be interesting to see if this could be something that's evolved into other demographics.
I just thought maybe the infrastructure was there because of the previous home share, that it could be, used almost immediately.
I think so. I'm not sure how it was structured, if that's even maybe part of the conversation yet. I think it was focused on international students and Georgian College students and facilitating housing that also supports reducing social isolation and bringing in some level of income. So maybe it's a net new conversation to have.
Yeah.
Thank you.
All right. Okay. Any other questions, comments? Molly?
We've just heard about an organization that does it. Why do we need to reinvent the wheel?
Well,
Because-
basically, I've gone into that website for that organization, and they match. So you go on and you volunteer your place, and then someone else will go on and say, I want to find a place, and they try to put the two of you together. Okay, the issue becomes what's available, and how many people are actually using that resource. Whereas with Georgian College, they actually have individuals who are doing the follow-up. Whereas on this website, it's the website actually is used to draw people together. So they don't really have manpower, whereas Georgian College has manpower to help to bring people together and match people specifically. So it's a different kind of way of doing it. I think you need both, because in a community like Barrie, there's a great need, and a lot of people, like you say, can't use a computer. So for those people that can't get on and use a computer to try to find a match, Georgian College would have some.
Is Georgian the one that matches a student with a senior?
Yes. Their social, what their program was before, they used their social work department, and that department was the one that was matching people together. The city of Toronto still has that program, so they found it beneficial, but they put resources in to do that in the city of Toronto.
But it was a senior with a student.
Yes.
It was not a senior with a senior.
That's correct.
Okay.
Gwen, do you have a question?
Well, I just thought if you were talking about the seniors, women living together, that excluded men. I think Paulette had her hand up.
Yeah, go ahead. Paulette?
I just wanted to say that the questions I had and the comments, they've already been talked about, so I don't have anything else. Thank you.
Okay, thank you, Paulette. Maybe that's something that will come up at our meeting with the seniors when we meet at the different locations. I'm sure it will be something that will come forward. So looking forward to hear what people's needs are, for sure. Okay, if we don't have any more questions, then I will get back to you with the dates and times and see who can fill in for us. And as soon as I know the times, then we'll go from there. So Heather, so as soon as you can send me the times, that would be great. Yeah.
Donna, if you feel, I do have a question.
Okay.
And I do support the idea of having someone from this committee on the geriatric committee. And I also echo what Molly was saying. Although I do want to go back to the age-friendly plan. At one point we did try to have the health conversation, and I think you know, at that time and at this time, it's important to intersect on the health. But at that time, it was determined that we were not going to be involved in that aspect. I don't necessarily agree with that. I do support being involved, but how are we addressing that, like going and including it now?
Well, the age-friendly plan, the city doesn't have someone who is responsible for continuing to follow up on that plan. And at this time, the committee is recommending in its terms that all it be responsible for is making recommendations that on the age-friendly plan, but not necessarily the committee's responsibility to develop and continue to update that plan. So while that is something that the committee can have a question or have make suggestions to, it doesn't restrict the committee from being able to make comments about healthcare issues that are impacting or that need to be dealt with in order to service and help the citizens of Barrie. And so the committee can address other issues. It doesn't have to strictly address issues relating to the age-friendly plan. It's our mandate that we looked at and made changes to said any issue that it impacts seniors in Barrie. So I think that's something we can still, as a committee, make recommendations for and see if there's a way that the city can help the seniors in that aspect.
I wonder if that's a piece to continue to keep a light on that Lucia is referring to, and maybe as we get the comments through the surveys, when we take that information back and say what actually relates to things that we heard and tied to recommendations in that plan, and is there anywhere that we're seeing a need to continue to promote, and is that the committee, or do we need to move that to the seniors working group of the Ontario Health Team, or do we need to say this needs to be part of a mandate to explore further in the next term of this committee over the next 4 years?
Mm-hmm. Yeah, I think that's a good point. We could put that on our agenda for our June meeting and maybe have a discussion, because we should have these surveys completed before our June meeting. Okay. All right. So our June meeting, what we'll do is do a post follow-up on the town halls and see how we did on that in that respect. Okay. If nobody has any more questions, we'll call the meeting to an end and look forward to seeing everybody at one of the sessions and hopefully in our June meeting. Thank you.
Thank you, Donna.
Okay, thanks.
Thank you, Donna. Thank you, everybody.
Thanks. Great meeting, everyone.
Thank you.